The prevalence of non-communicable diseases in Ghana is worrisome, killing over 94,000 Ghanaians annually, rendering others disabled, with many children lacking basic needs of food, shelter and education. To arrest this, government has put in place policies for the control of tobacco use, including tobacco taxation. There's been recommendations by ECOWAS and WHO as cost-effective interventions for preventing and controlling NCDs. My colleague Jacqueline Yaboa brings us her interactions with smokers and tobacco product dealers.
Well, there's been a lot of talk on the use of tobacco in Ghana, talking about the detrimental effect it has on our system, and also currently the price increase on tobacco in Ghana. Currently I'm with a couple of tobacco users and also one of the owners here who also sells it, to have a conversation with them when it comes to the taxes, the fact that now there are more taxes on these items, but still the consumption seems to increase, and the fact that there are detrimental effects, but still they continue to consume it. So let me just start my conversation with them. Hello sir, how are you?
I'm doing well.
I'm doing very fine.
Yes, please.
Okay, my first question, you taking cigarettes?
Yes, of course, I take cigarette.
All right, so why? Because I can see smoking causes rotten teeth, it damages your unborn child, it doesn't let others smoke, it causes rot a whole lot, but why do you still take it?
Yes, as you rightly said, it is written there, but we've been taking it since long, and it is something that boosts my immune system. Somebody can take something to boost his immune system.
It boosts your immune system?
Yes, I like tobacco. Whatever you write there, I don't care. After all, even the current government, taxes here, taxes there, taxes wherever, but everybody is moving on. You cannot stop even the government on power not to impose taxes on certain things, but he's doing it. So if a group called itself has come out to say that they are putting on taxes on cigarette or tobacco, it's a welcoming news, but that wouldn't deter us from taking tobacco. Tobacco has been part and parcel of us, and it is with us. We will never leave tobacco. No matter how much they increase it, we will smoke tobacco. Even if they put it 100%, we will still smoke tobacco, because tobacco is part and parcel of us.
Yeah. No, how long have you been taking tobacco?
If I'm not mistakenly, I started tobacco when I was 16 years.
Wow.
Tobacco, yes, 16 years.
And how old are you now?
I'm now 48.
That's a very long time.
Yes.
But doesn't it have any effect on your body?
I've never been to hospital, and my doctor has proven that tobacco has an effect on me. I have no.
So you as for you, dear, no side effect on your body?
My doctor have not proven it yet, so I feel that I'm okay.
So I have another gentleman here who also you take into.
I take tobacco.
Okay. Now, how long have you been taking this?
Let's say about 5 years. Is it 5 years? Yeah, exactly 5 years.
The side effect that they talk about, I see a lot causing breathing issues. Have you experienced any of them?
I know how this is caused, but I have not experienced everything about it. Like, and I don't have any effect about it. And
you are very fine. You're okay.
I'm okay. Right now, I'm going to take some right now.
I see. Now there are taxes. The big conversation is there are taxes.
They have to take the tax from it, because this thing is killing people, plenty people. So how can you put a tax on it? Then that means you are not going to buy again. Oh,
if they still continue the tax, you are going to stop?
I will stop, because I cannot.
Don't you think that would benefit the government?
Then I don't have a problem. I don't care.
So you stop?
I will stop, so that I'll be free.
Let me come to you. Have been taking it for long. If the taxes increases, are you going to stop?
I will never stop it, because I know what it does to my system. I love tobacco. I love tobacco. Tobacco of any kind, I love it.
Auntie, and even if they say they are going to sell tobacco, one stick, 20 cedis, and I fail to buy it, I'll go and buy it.
That brings me to the taxes. The conversation is that taxes have been imposed on these. You know, it used to be called sin tax.
No, why? You go continue smoke.
Why wouldn't you? So, don't you think it's putting a lot of weight in your pocket? Because you are then spending a lot to get that item.
Gold Coast time now, car price was low. By now the car price was up. But still, we are buying car.
So regardless. Okay, all right. So, just as you heard from these gentlemen that I've been speaking to, regardless of the taxes that are being imposed, high prices of tobacco in Ghana, regardless, they are still going to continue to take it. But some are also of the opinion that when it keeps on increasing, they would have to probably resort to other means or quit and not buy the tobacco anymore. Right here, I am Jacqueline Asuma Yeboah reporting for Joy News.
Well, according to a research finding by Vision for Alternative Development Ghana, the tobacco industry is influencing the implementation of the Excise Duty Amendment Law passed by Parliament last year. Director of Programs at Vision for Alternative Development, Labaran Musa, joins me on Zoom with more. Labaran, good to have you.
Yeah, thank you for having me.
How did your research conclude that tobacco industry is influencing the implementation of the Excise Duty Amendment Law passed by Parliament last year?
Right, so thank you very much for having me. I know we've had a couple of, engagement even on your network prior to the passage of the Excise Duty Amendment Bill, Act 1093. Yes, so you notice that throughout the process, there were a lot of activities that actually went on. And one of the things that actually the public health community were very mad at is the fact that even before the bill was passed into law, you also the drama that happened in Parliament where it has to go through voting before a public health act or a public health intervention could go through, successfully before it got passed. So the point for us is we actually have to embark on, some study to understand, to what extent, the industry, got involved in all of this. Now, you wouldn't find clearly a very direct, influence or a direct lobbying, but activities like, media engagement, drumming home the fact that, the taxes, would lead to, job losses, and the fact that the government is overburdening the people with taxes. And then we also cite some documents that were sent to the various sector ministries, urging them not to a kind of add taxes to tobacco products or other unhealthy products. So in fact, all of this, including the fact that we also had some civil society organizations who were also fronting for the tobacco industry by also, joining the chorus, and then also advocating for the fact that one, there's a tax increment on tobacco products or other unhealthy products like tobacco and alcohol, and then SSB. It will lead to a lot of things, like I mentioned. They also mentioned illicit tobacco, and then also smuggling, and then the fact that, like I mentioned, governments are burdening the people, and that there's a need for government to restrain from adding more tax or adding more burden to people. But we all know that this product, this excise tax that was proposed by the Ministry of Finance was actually, a corrective tax. That's how we call it. It's called a health promotional tax. It's also called an excise tax because, it does so many things, including the fact that it reduces exposure and accessibility to children, who are mostly the target of the industry. And I say this because me and you currently, if we decide not to smoke, there's no way we're going to smoke. So the target has always been our children, the young ones who are coming up, because definitely these are the targets who they could always, target with their product. And that's the reason why you see that these products were very cheap in the market. Last year, they were very cheap in the market. So anybody that can access, exposing our youth and our children to the product.
So
the point for us is...
What's your recommendation?
Yes, so let me just add that. Listen to the conversation that went on with the smoker. You notice that most of them are, started smoking at a very young age. And we also have to assess their level of income and how are they able to care for their family and then the young ones and even their children. The point is this: once they become hooked, and it's called a nicotine that is found in the product. That's why these people cannot stop smoking and they'll continue to smoke. So the point for us is governments putting measures like, increasing taxes, because the taxes that were levied on the product, for us, we think that it's not punitive enough. Government need to up the taxes, if possible, increase it to by, maybe another 50%. So we can have the raw impact that we want. Because at the end of it all, people who smoke would definitely have some complication. The person have chronic conditions like we are currently facing. Our renal center have been closed down because of the number of people who continuously go to the hospital because of kidney problems, because of lung problems, because of heart failures, and it's because of this product. So government need to really look at many interventions, including the fact that taxes are one of the best that many countries are imposing on their product, just so we can reduce exposure to children, improve public health, and then also ensure that at least we get revenue so that people who continue to smoke, at least we say they can be compensated, because no matter what you do, you get problems. So once you get sick, at least the money that have been accrued, government should set aside at least earmark a percentage, if not all the funding, to support healthcare and go to chronic diseases like the renal center, the center at Kolebu, where diabetes and hypertension, people are suffering heart disease. So at least these funds can go there to support people who are suffering from this kind of diseases. So that's our appeal to government.
I'm grateful for your time. Labaran Musa is the program's director at Vision for Alternative Development Ghana. Now let's get